Good morning, everyone. Hey, so I just got this text message from Vlad. Vlad is our doctor support for MoveNow University, helps answer questions for doctors, mostly on trying to figure out if this is right for them in their practice. So like when you go and sign up for our demo at demo.movenowu.com and you watch the demo, Vlad reaches out to you and a lot of times you doctors will jump on a call with him and he'll talk you through and figure out, is it right or is it not right? In some cases, it's not right for you. It's not a good fit. In other cases, it's a perfect fit, but you still have objections that you need to get past in your own mind or have worked out to really see that it's going to be beneficial for you. So he just sent me this message and he said, what's going on, buddy? Oh my goodness, you got a Rubik's Cube? Well, Grayson, I'm actually doing a video right now, so why don't you come back inside? Here you go. Oh, you want me to do it? Okay, hold on one second. Have a Rubik's Cube right here. He wants me to fix this, and it's going to take me a little while to fix this. Okay, I'll be in just a minute. Okay, so anyway, Vlad just sent me a message, and the message was, he said, I have doctors that say I have a lot of older patients, and I don't think they're going to want to do this. And then he's asking me, okay, so how do you overcome that objection when talking to doctors? And he's asking that because he's saying, like, what's the answer to that? Is that something that is legit? Is that something that you see? Is there any sort of other perspective on that? And I'm going to share a story of a guy named Mike B. All right, he's a patient that has gone through 3 phases of corrective care with us at our clinic, just took a 2-month hiatus, contacted me and says he wants to get in and keep going, and now he just started back up with us this week. So he's on his 4th round of corrective care with us. He's 74 years old. He came in, his posture, his movement was like this. I'm going to show you in the mirror. Tucked under with his pelvis, super forward like this, could barely move, bilateral hip replacement. And he went and saw a neurosurgeon, and the neurosurgeon said, can't help you. You're too old and you're too fat. That's the exact words that this neurosurgeon told him. He came and told me this when he came in for his new patient appointment. Now, is this a guy that doesn't want functional movement, doesn't want to do corrective care, doesn't want to do chiropractic? Quite the opposite. He's like so many of our patients, and we have patients that are over the age of 70. We have a handful that are over the age of 80, but 70 to 80 years old is not a rare age for us in our practice. And on the flip side, if you have a practice that's mostly geriatric patients and they're like 70 to 90 years old, they need this more than anyone. And the way we do our consultation with them and the way that we explain this to them is that as you get older, if you don't have a heart issue, heart, stroke, cancer, what's going to kill you is a fall. What's going to kill you is falling, hitting your head, okay, or falling on your hip and breaking your hip and then not being strong enough to be able to recover from it. And there are more people that advance in age that die from really inability to function and move, and then something like that ends up killing them, not cancer and heart disease and stroke. That's all the stuff you hear about, but the thing that kills people as they progress in age is inability to function properly. And that starts with segment, posture, movement. So on the contrary, Vlad, hopefully you're watching this, Vlad, because you asked me the question, and other doctors out there that are thinking about this, hopefully you're watching this so that this can help address this for you. The way we designed MoveNow protocols is perfect for geriatric patients. It's perfect for patients that have Medicare and come in and want to know what to do, and nothing's covered on Medicare except the adjustment. So how do you make it work? That's how our whole program is set up. It's communicating that to the patient so they understand the value in what you do. They are happy to pay for it out of pocket because they can see how valuable this is for their current health and their future health. And then the systems are totally set up to work with any sort of individual, whether it's a younger athlete that needs to be challenged at a higher level, or an older geriatric patient that's never worked out a day in their life. Good morning, Brandy Hunter. She is our office manager at Constance Pine and Wellness, also MoveNow Doctor Support. Brandy Hunter, say something for the audience. Let them know in one sentence, do our older patients engage in functional movement? Is this right for them? What do you see, being the fact that you manage our clinic and you see all these patients? Do we have older patients that engage in this? Her answer is going to be absolutely. Does it change their life immensely? Yes. I would argue that they need this more than anyone. And so that is really more of a reason to do functional movement, making sure that your older patients know how to get up from a seated position with strength, making sure that they don't lose all lower body strength in their legs and they can't get up out of a chair without assistance. Various studies out there have shown that when someone progresses in age and they cannot get up out of a chair without someone pulling them up, statistically speaking, they die within 4 years. Do we let our patients know this? Absolutely. Why? Because that's an important statistic for them to understand. Why is it you can't get up out of a chair? Because you lack strength. Maybe you lack mobility in joints. Maybe you have pain. All of this originates from the spine. The spine is what controls movement in all the extremities, whether it's a neuromuscular control or just mechanically. Everything has to be cleared in the spine first. So that's why this model is so perfect in chiropractic. That's why we need to own this above all else, above all any sort of rehab specialist, above physical therapy, above personal training, all of that. It should be done in a chiropractic practice. I strongly believe that. You have to be addressing the spine. You have to be looking at posture, especially with these older individuals, their sagittal alignment. This guy, it's a case I've gone through before of his pre and post x-ray, but something that we measure on the side view is we take a lateral full spine x-ray and we measure C1 to S1. So where does C1 sit over S1? Tons of orthopedic and neurosurgical journals talking about the relevance of this sagittal posture, okay, sagittal alignment. And they look at C1 over S1. C1 over S1, as C1 comes more forward, okay, someone's health outcomes go down. Their movement goes down. Their life expectancy goes down. Look at like Cato study, the Rancho Bernardo study, Cato, showing that community dwelling individuals with the hyperkyphosis, measuring the head wall distance, the more that the head wall distance increased, the worse their health outcomes was. Okay, so this whole sagittal alignment thing is a big deal. We measure C1 to S1. This individual, Mike B, when he started off, he was approximately, I believe he was 6 inches forward. I'm pretty sure he was about 150 millimeters, 6 inches forward, had a thoracic hyperkyphosis, horrible movement in his hips, couldn't hip hinge to save his life, pain all over. And since then, fast forward, he said this is the first time in 20 years he's had this low of a level of pain. He has actual confidence and hope that his life it has some kind of meaning to it moving forward, because he felt completely destroyed by this. He had so much pain and inability to function and move. His follow-up x-ray at 12 weeks, he went from 150 millimeters, I think he came back to 60 millimeters, which is insane. So he went from 6 inches forward to about 2.5 inches forward. And then he went through another 12 weeks of care. We did another comparative x-ray, and he went from 60-some millimeters to then 30-something millimeters, halved it again. So he did really well. He discontinued care for a couple of months. He had some business stuff he had to take care of, some properties that had to be sold, told us it was a hectic time in his life. But he said, you know what? I've done pretty well, but I knew it was time for me to get back in because I haven't been keeping up with all the stuff that I know I should have been doing. But he actually held up pretty well. So we just started seeing him again last week, and he's getting back on track again. And now what we're doing, since he's learned so much of our basic functional movement stuff, now he's going to get more into the strength component. And in our setup, in our clinic, conveniently enough, our main exercise therapist, David, also is a personal trainer, and he's going to start doing personal training with some of our patients that want to go into more of a strength regimen. So this guy's already done 3 rounds of corrective care. He's going to continue doing a lesser version of corrective care, but he's going to start personal training with our exercise therapist. It's like the perfect model. So Vlad, if you're watching this, because you asked the question, I don't see you on here watching this, you're probably Oh, you are watching it now, Vlad. You just jumped on at the tail end. You have to go back and watch the whole thing. So I'll say real quick. So Brandy said, good morning. Our older patients appreciate the movement most. Totally. It's so huge for our older patients. This is such a like, I guess I can understand how that question might be a objection. It might be a concern that maybe the functional movement thing is only for the younger population, that they're the only ones who can be interested in it. It's quite the opposite though. And our protocols fortunately cater to that. Dr. Perry Barnhill, how's it going, my friend? Good morning. Dr. Perry Barnhill at Fearless Chiropractor. Awesome dude, great guy to know, helped us out tremendously. You want to know about compliance, you want to know about insurance denial, and he works and helps us at MoveNow University. So reach out to him if you have questions. He's always very generous to answer questions, even if you're not part of his program. And his program is like pennies for what he covers. So I would encourage you, if you don't have someone covering your you know what, talk to Dr. Perry Barnhill. Awesome dude. Can't wait to have you out here in February. Dr. Perry's going to be here at our Impact event. And then we got Vlad Modorsky. Vlad is our MoveNow Doctor Support. He is our online guru, does all kinds of cool stuff. And then just to mention again with Brandy, Brandy is our office manager at Constance Pine and Wellness. Also MoveNow Doctor Support. She's been working weekly with a clinic up in Canada that we're actually flying out there. Brandy and I are flying out there to do an in-person implementation. She's doing a phenomenal job working with this really exceptional clinic. So that's going to be fun to cover that as well. Anyway, so moral of the story, yes, geriatric patients, older patients need this. They welcome it. They love it. Our systems support it. Not a objection at all. And just like we're taught, when someone has an objection, it's just because they want more information. It's not that they're saying no, they just want more information. Remember that with your patients. When your patients have objections, they're not saying no to your recommendations. They just want more information. They want more clarification. They want more certainty. There's something they don't understand. So hopefully this helps everyone understand that functional movement and MoveNow University works awesome with the older population, the geriatric population. All right, I'm going to finally work out now, I promise. All right, so I got to work out because I'm going to go film with Fred here in a little bit. So Dr. Todd from MoveNow Garage Gym at home here in the secret lair in Eagle, Idaho, wishes you a great day. Over and out.